Preparation for RRB staff nurse examination. Here I discuss the MCQs from Pediatric Nursing, and it is my second class, and previously I upload the first class also. So go to the question. Hypothermia is called when the temperature of the newborn is, the options are, you see here, 36.5 or 36, 35.5 or 35. So the correct answer is less than 36.5 degrees Celsius. If the body temperature of the newborn is less than 36.5 degrees Celsius, the baby is suffering from hypothermia, and hypothermia has three stages: mild, moderate and severe. In case of mild, the temperature is 36 to 36.4 degrees Celsius. In case of moderate, the temperature is 32 to 35.5 degrees Celsius, and in case of below 32 degrees Celsius, the baby is suffering from severe hypothermia, and you should place the baby in the warmer to prevent from hypothermia. So here is the correct answer. Next, the need for resuscitation can be identified by rapid assessment of three characteristics except. Here you see the options, and at first you should know that which is the important characteristics you must assess to check need for resuscitation. At first you see baby is crying or not, then term or not, and good muscle tones. So it is not important characteristics to check the need for resuscitation. So here is the correct answer, weight of the baby. So our three characteristics you must assess to check there is need for resuscitation or not. Next question is, for preterm baby, size of the suction catheter is 10 French, 8 French, 6 to 8 or 7 to 10 French. The correct answer is, guess what? The correct answer is 6 to 8 French. 6 to 8 French is the size of the suction catheter. So the correct answer is 6 to 8 French, and the size of the tube is 3 mm. And you also see the correct size of the catheter for term babies. Here I tell you the size of the catheter, suction catheter for term baby is 8 to 10 French. So for the term babies, the size of the catheter, suction catheter, is 8 to 10 French. And size of the tube is 3.5 to 4 mm. 3.5 to 4 mm is the size of the tube. So here is the correct answer is 6 to 8 French for preterm babies. Here you see the picture of the suction catheter and color code for the size. Here you the deep green for 6, size for 8 the color code is blue, and 10 for black, 12 for white, and 14 for light green, and orange for 16, red for 18, and yellow for 20 French. Here is the coding system irrespective of size. And for neonates you use the blue and green, 6 to 8. It is maximum use. And here you see the several parts of the suction catheter. At first you see the picture, and this is made up of polyvinyl chloride, and this is the transparent tube for clear visualization, and this is the lateral eye and color code for size identification, and this is the funnel connector. Here you see color, and irrespective of color the size is measured. Next question, for resuscitation of newborn, the capacity of self-inflating bag or ambu bag for term babies. The options are 250, 300, 450 or 500 ml. So the correct answer is, for the term babies, the correct answer is 500 ml. Self-inflating bag or ambu bag, the capacity of the bag is 500 ml. And you should also know the other sizes: 250 ml for preterm babies and 750 ml for term babies. And here the question is for term babies, so the answer is 500 ml. So the capacity of the ambu bag is 500 ml for term babies. And next you see the picture of the ambu bag and several parts of the ambu bag. It is mainly made up of silicone, and here you see the part. It is the self-inflating bag. Self-inflating bag, it is the oxygen inlet, and it is the air inlet and pressure release valve. It is the reservoir bag, and it is the oxygen tube. Here you connect to the oxygen cylinder. And next the swivel, and next the face mask, and it's vary the size for term and preterm. This is the outlet, also called the outlet. And here I also tell you the size of the outlet or face mask. For the term babies, the size of the outlet is 1. The size of the outlet is 1. And please note that this important informations, it is very important information. And for preterm babies, the size of the outlet is 0. For the term babies 1, and for preterm babies the size of the outlet is 0. So it is all about this ambu bag. Next, in spite of administration of effective chest compression and positive pressure ventilation with 100% oxygen saturation, if the heart rate of newborn is still less than 60 beats per minute, which medication should be administered? The options are diazepam, salbutamol, epinephrine, vitamin K. So the correct answer is epinephrine. The correct answer is epinephrine or adrenaline. Epinephrine or adrenaline should be administered the baby within golden period, means 16 seconds after birth, to prevent from the mortality of the baby. Epinephrine must be administered if after 30 seconds of birth newborn is still less than 60 beats per minute. For premature labor, which drug given to bring about lung maturity of fetus? The options are oxytocin, vitamin K, phenytoin or glucocorticoids. So here the correct answer is glucocorticoids. Glucocorticoids must be given in premature labor for maturity of lung of the fetus. Actually, it is recommended that all the women at high risk for preterm labor before 35 gestational weeks be given glucocorticoids at least 24 hours before delivery in order to markedly reduce the neonatal mortality and morbidity and for the maturation of the lung. Next, Green urine may be observed in newborn within 24 hours of birth. In which condition? Baby with birth asphyxia or baby with MAS, preterm baby or IUGR. MAS means meconium aspiration syndrome. So baby with meconium aspiration syndrome passes green urine within 24 hours of birth. And IUGR means intrauterine growth retardation. In case of the meconium aspiration syndrome, you see green urine. Next question is, in neonatal, the jaundice serum bilirubin level is greater than 50 mg per dl or 10 mg per dl, 13 mg per dl or 5 mg per dl. So the correct answer is 5 mg per dl. In case of the neonatal jaundice, the bilirubin level is 5 mg per dl, and jaundice is two types, physiological and pathological. In case of pathological jaundice, the serum bilirubin is greater than 40 mg per dl, and in case of the physiological jaundice, the serum bilirubin less than 40 mg per dl. Next is neonatal hypoglycemia, defined as when blood glucose level is less than 25 mg per dl or 40, 60 or 10 mg per dl. Guess what is the answer? Hypoglycemia is called when the blood glucose level is less than 40 mg per dl. When blood glucose level is 40 mg per dl, the baby is suffering from hypoglycemia. So here all the questions and answers are from Pediatric Nursing book. For reference, this is the book in which I made the all questions. So please subscribe and like for more videos and for practice the RRB examination. Join with the class.